Hi everyone and welcome to the Carefeed Channel. I'm John Vander Meer here with Dave Voepel, CEO of the Arizona Healthcare Association. Dave, it's great to visit with you. Thanks for taking the time to talk with me during the summer of 2024 about some of the challenges and opportunities facing the long-term care provider community in Arizona and around the country.
Yeah, absolutely. Thanks for having me.
So Dave, what would you say are the key challenges that are facing providers in the state of Arizona?
Yeah, I think it's the same throughout the country. It's just exponentially different in certain areas. Arizona, not like any other state, we need more reimbursement. We got to have more money to give more care, to hire more caregivers. And then to the caregiver end of it, it's always, you got to have more of them, so we have a workforce issue.
Right.
You can't find them.
Absolutely.
So those two things coupled together are really the mainstay of what's happening, I'd say, around the country, to varying degrees, of course, and even around the state of Arizona to varying degrees, because I can show you some facilities that are fully staffed and they have 100% occupancy.
Sure.
So it's just different from wherever you go, but for the most part, it's reimbursement and workforce.
In light of the workforce issues and the reimbursement issues, where are you at in your association's legislative and budget advocacy cycle, and what can members do to help advance the association's efforts?
Yeah, we just got done with our legislative session. So in Arizona, we have this 100-day thing.
Okay.
They come January and they say, we're only going to be there 100 days. And then they're there till June 30th.
Right.
That ain't 100 days. That's more like 200 and some odd days. But June 30th is the budget deadline.
Okay.
Because that's when the new fiscal year starts, July 1st.
And how did things turn out?
They didn't. We got pounded by the advocates, and they wanted more memory care training, they wanted more fines and penalties, they wanted a lot more pieces, and we were able to take many of those pieces and put them into one piece of legislation and create an omnibus long-term care bill that wasn't as onerous as it started out as.
Sure.
We weren't able to get an increase, and that is the second year that we weren't able to get an increase. So
Sure.
The last increase we had was 13%, which started October 1st of 22.
Okay.
So next year, we're going to revamp a few things. Out of this piece of legislation that happened this year, we call it it's House Bill 2764, out of that was formed a study committee.
Okay.
And in that study committee are a whole bunch of representatives, whether they're from our group or from the advocacy group and some of the other associations, so forth and so on, plus the governor's office, state senators, representatives, all that good kind of stuff that are always melded into these study groups.
Right.
And within that, we're going to be looking at cameras, we're going to be looking at abuse and neglect, we're going to be looking at a whole piece or a lot of pieces of different areas. Next year, when we come into legislative session in January, we're going to be going after the legislature for another ask on the Medicaid reimbursement side. Just because we haven't had one, and with inflation, it's really been tearing us apart.
So it's almost like a cut.
Yeah, with inflation, you throw inflation in there and you throw the workforce challenges and how much you have to pay on the increased salaries, it's a cut.
Yeah.
Yeah.
And not to mention all the other employers that are out there, big box retailers,
big time.
coffee shops.
You go to a rural facility in Arizona and you'll be struggling to get an RN, first off, to find an RN.
Yeah.
And then to pay for one is another struggle.
Yeah.
It's totally ridiculous. And then we have the regulatory pressures thrown on top of that. So next year we're going to be coming forth with a funding package and a regulatory package that's going to be, we want to redo long-term care. It's like, we got to have the dollars, and let's put some thoughtfulness into this.
Yeah.
Let's put a little strategery into doing some regulatory reform.
Makes sense.
So yeah, and we'll see what we can get done.
Right. So what can members do to support your efforts relative to those strategies?
Well, we're taking a page from HCA National, which took a page from Florida Healthcare Association and many other states around the country.
Okay.
And they revamped their lobbying. They went to weekly lobby days. We're going to do the same thing in Arizona.
Interesting.
So we're going to pull in 2 or 3 or 4 facilities, whatever, every week from February until April, when our budget cycle is supposed to be finishing up. And every week they're going to come in, they're going to meet their legislators, they're going to talk about reimbursement, and they're going to talk about the regulatory issues.
Great.
Yeah.
Great.
So we're going to hit them as hard as we can and see what happens.
Good.
Yeah.
Good. So you were just talking about regulatory issues. Are there specific regulatory issues that you're concerned with in terms of the survey and certification world? And
Yeah.
how can providers help you relative to those types of efforts as well?
So there's always a disconnect between regulators and providers.
Sure.
You know, some of that's built in. There has to be. You have to have some separation. We want more collaboration. And with that, we passed House Bill 2501 this year.
Okay.
House Bill 2501 was our initiative, and it basically said something very simple. It was like 2 paragraphs. And it said, you will train together. At least once a year, the surveyors and the providers will get together at the association's expense, and we'll train together and talk about the big issues of the day, whatever that might be.
Interesting.
Yeah, so we're going to come together and we're going to hear from the same
Source.
speakers, the same source, what the actual regulatory issue is. And then we can all talk about it. The surveyors can go back and do their survey work. We can go back and try and implement it. And at least we'll all get it from the same source. We want to take that next year and expand upon it by saying, okay, right now we're having timing issues with 2567s. We're having fines and penalty issues. We're having our 2567 timeframe is bumping up against our do not admits. We want to be able to look at that and say, okay, what can we do legislatively to make things gel a little bit better?
Right.
And build upon what we're starting with this annual get together. So it's kind of an expansion, and it's common sense.
Yeah.
You know?
Well,
And
those
it's
who
more
train together,
collaboration.
right. Well, those who train together at least have the same common set of facts and,
Yes.
a basic interpretation of
Yes.
of what the regulatory promulgated rule, whatever,
That's our hope.
ends up. Yeah.
Yeah, that's our hope, so that we can all hear it together at the same time.
No, that
Yeah.
makes perfect sense.
Yeah.
What are you looking for from your members? I'm sorry, what are your members looking for your association's help with most? I mean, what do you most often get calls about?
Yeah, 2 things, survey and certification and workforce.
Okay.
We were lucky enough to be the recipients of a $6.5 million ARPA grant through our governor's office. And it was designed to put 1,500 caregivers and CNAs. A caregiver is a technical term in Arizona for an assisted living CNA.
Okay.
For all intents and purposes.
Got it.
Okay, so between the caregivers and CNAs, 1,500 of them over a 2-year period, and that was supposed to be, we were supposed to be putting them into long-term care. Now, that includes recruitment, training, and retention.
Okay.
All of those dollars.
Sure.
We ended that on June 30th with over 2,200 caregivers and CNAs
Wow.
put into facilities.
That's amazing.
And our retention rate was crazy. It was well into the 80% range.
Great.
And I don't remember the exact numbers, but we ended that June 30th. So we've been talking to the governor's office and to the legislature and anybody else that will listen. It's like, why can't we expand this program?
Why shouldn't this program be permanent?
Yeah, exactly. So we're taking government-funded dollars, and you got more bang for your buck. Instead
Right.
of 1,500, we put over 2,200 in
Uh-huh.
there. And we're giving these folks to long-term care, whether it's assisted living or skilled nursing facilities.
Right.
And that expanded the workforce.
Yeah.
So doing something like that again, that ended June 30th. So doing something like that again, or continuing that program, is something that we're trying to build upon.
Great. Well, so I know that you had your convention this summer.
Yeah.
Carefeed is a business partner of the
Yeah.
Arizona Healthcare Association, supporter of your convention.
Greatly
Yeah,
appreciated.
absolutely.
Absolutely. That's the only way we can make our convention and expo and all of our other programs
Possible.
work. Yeah, that's
Right.
for sure.
But other than that, are there any major events that you'd like to take this opportunity to plug, or anything that's specifically on your horizon? You're also the affiliated State Healthcare Association president.
Right.
So like all of the state healthcare associations end up having their own executive directors and own their own CEOs, and you're the chair of that group, either with events going on with your association or just generally. What are some big things that you'd like to mention now?
Well, we affectionately call it ASHKI.
ASHKI.
Yeah, the
that's
ASHKI
right.
group. So that's a long acronym for State Healthcare
We love
Association.
acronyms.
Yes, we do. Yeah, and we appreciate your support on that end too.
Absolutely.
Because that's a national endeavor, and it's pretty cool to get all of the state execs together, or a super majority of them.
Right.
I think there's 30 30 or 40 of them that come to most of our programs. You know, for the freestanding meeting that we have, we end up with 30 states there, and you can hear the different nuances that people are doing. Again, it goes back to the beginning of our conversation where we were talking about Medicaid reimbursement and workforce. Well, everybody's got these cool ideas in other states, and we all get together and talk about them.
Yeah.
So we appreciate your support of
You
that.
bet.
And then on the Arizona healthcare side, we do quality forums. So we take a day and we do a deep dive into things. And we're going to be doing that, for instance, on survey and certification.
Great.
So that's going to be coming up here in the next month, I believe in September. And so that's going to be our next big forum. And then we have an AL symposium coming up. We have another quality forum after that. We have a PDPM forum. So we have a lot of cool stuff happening.
Yeah, no, it sounds amazing. And where can people go to find out about all this great programming the Arizona Healthcare Association has?
azhca.org. You can go to the events calendar. You can see all of our events. And then we're planning for our convention already next year. It's going to be a month earlier. We're going to be June 16th through 18th next year, and we're going to be at the Renaissance out by the State Farm Center where the Arizona Cardinals play football.
Great.
Yeah.
Wonderful.
So it'll be a blast.
Great.
Yeah.
Well, hey, Dave, thanks so much for visiting with me today.
Yeah.
Really appreciate it.
Yeah. Thank you, John. I appreciate it too.
You bet.
Yeah. Thanks.
I have been visiting with Dave Voepel, CEO of the Arizona Healthcare Association, here on the Carefeed Channel. Be sure to visit carefeed.com to see how the resident journey platform of Carefeed makes the lives of providers easier while enhancing connections between staff, residents, and their families. Click the schedule demo button to book a time to see how Carefeed's all-in-one platform can save your team time and money while improving resident and family satisfaction. Don't forget to hit the like and share button on your social media dial and follow Carefeed on LinkedIn, Facebook, and YouTube. Thanks for watching.